Don't have time for a setting sun, but I give my life for a rising one. Don't have time for a setting sun, but I give my life for everyone. The sun comes up and the nation rises when the people come together. Yes, the nation rises. Brave men stand up and the nation rises when the people come together. Yes, the nation rises. Don't have time for a setting sun, but I give my life for a rising one. To you, George Washington. Don't have time for a setting sun, but I give my life for everyone. To you, America. The sun comes up and the nation rises when the people come together. Yes, the nation rises. Brave men stand up and the nation rises when the people work together. Yes, the nation rises. It's been a while since old Washington gave his life to this great nation. Again, it's time for a rising sun, so let's stand up all and work as one.
Brave man, stand up in the nation and the people work together. Don't have time for a setting sun, but I give my life for a rising one. To you, America.
All right. Good morning, America, and welcome to this morning's huddle brought to you by Going on Offense. My name is Darrell Moon, and I'll be your host today. Thank you for being with us, and we hope you will join the conversation. We have some wonderful guest panelists with us today to talk about preparing to reopen. I hope you will participate and share your ideas and suggestions with us. We're holding these huddles every Monday, Wednesday, and Friday in an effort to be supportive for those struggling, to brainstorm strategies to help, to promote resources, and to engage collaboration. Now to introduce today's guest. It's my pleasure to introduce to you two friends of mine, Jessica Brooks Woods and her husband, Marlin Woods. Jessica is the CEO of the Pittsburgh Business Group on Health, a leading healthcare employer-led coalition in the Western Pennsylvania region. They empower employers to change healthcare. Marlin is the CEO of Benefits Consulting, the Match.com of health and welfare benefit solutions for employers, and an Amazon best-selling author. I'm going to invite each of them to take 4 or 5 minutes to introduce themselves and to share a comment or two about today's topic. But before I do, I want to invite all of you to participate in today's conversation. We would love to include you in the conversation, so just raise your hand on your control box at any time during the huddle, and I'll turn on your audio so we can hear from you and include you. Jessica, would you like to introduce yourself first, and then Marlin?
Sure, I'd be happy to. Thank you, Darrell, for having us. This is very exciting. I've attended several of your these Going on Offense webinars, and they've been helpful for me. So hopefully we can do the same for others during this time we have together.
Yeah.
So as Darrell mentioned, I am Jessica Brooks Woods, the CEO of the Pittsburgh Business Group on Health. We're an employer-led coalition of over 100 employers. The primary members of our membership are either headquartered in Western PA or have a significant portion of their populations, but we do touch lives all across the country, representing over 2.5 million lives the employees and families of the employer members. We have about $5.5 billion in healthcare spend represented within our coalition, and we engage a lot of other stakeholders that play a role in ensuring that we have appropriate access, high quality outcomes for everyone, and affordability that is sustainable for employers to remain to be the primary access to healthcare for Americans. Very excited about this year, and actually came into this year with a focus and a passion on health equity, mental health, and quality. Those were, before we knew COVID was happening, we said we have to take a bigger role as employers and take responsibility for the disparities that do exist in healthcare, define our role in that, and figure out what we're going to do about it moving forward. And also address the stigma associated with mental health and create better cultures that create an opportunity for everyone to have total well-being. And of course, address safety, which is familiar to a lot of employers, especially being in a region like ours, manufacturing facilities and things like that being our foundation. Safety is not new to us. And so we want to apply that to what employers' role will be in the safety of healthcare. And then COVID-19 happened, and it actually highlighted every single thing that we said we want to focus on and confirmed that we're going in the right direction. So that's some of our focus areas for the organization. Me, myself, I have been leading the organization for 6 years now, a little over 6 years. In that time frame, I've had 2 kids and had we had 2 prior to that. So 4 kids total, and so we have a very dynamic household going on right now with all of us in one place at the same time. And just happy to be here, Darrell, and we'll be happy to share more as we move forward.
Well, thank you, Darrell, for having us once again. I'm Marlin Woods. I'm just merely the arm candy. But also I am the Chief Executive Officer of Benefits Plus Consulting, which is a vendor management consulting firm. We simply vet health and welfare benefits vendors for organizations through custom criteria through a quantitative model that we've designed. It's quite simple. We call ourselves the eHarmony or Match.com of employee benefit solutions, matching employers to vendors based upon custom criteria. And it's just that simple. I'm also an Amazon best-selling author in the insurance class of Amazon with a book called Courting the Employ Her, a Business-to-Business Romance. Courting the Employ Her is a book that makes the uncanny parallel between romantic relationship between a man and a woman, comparing it to business sales representatives, professionals, particularly in the financial and insurance space. The responsibility that the business-to-business sales professional has is the same approach that a lovely single woman would expect of an available suitor. And we parallel those 2 dynamics together to provide for the broker or the service provider the responsibility in which is expected of them. So on our first day of sales, which is this month, actually May 29th of 2015, we released as an Amazon bestseller on the very first day. So that was pretty exciting to experience, to become a part of a very small community in this country, or even in this world, in being that of an author. I am a father of wonderful children who are here in the house. So to you, Darrell, and even your guests, listeners, we apologize now if you hear, "Stop touching me." And so it's been an experience, and we'll get into that, but it's been an experience having to be quarantined to the house with the children. It's restored some things and given us perspective on some things in our house that you take for granted commonly every day, the average person. And we'll talk more about that. So among other things, I founded a seminar, now a summit called the Empower Me Summit, and that empowers African Americans to reset their trajectory of Black achievement in this country. And we have an annual summit each year that now has since become weekly Zoom webcasts as it relates to navigating through COVID-19 and more specifically the quarantine, as it relates to how do we progress in this new norm, which is what we'll be talking about today. So thanks for having us once again.
And also, today is the
Yes.
10-year anniversary of the day we met.
Is it May 1st? May Day.
Yeah,
That's exciting.
Right. This is 10-year
Congratulations.
Yeah, absolutely.
Well, Marlin, I'm actually glad you brought up the book because I spent some time this morning on your website and was checking out the little video you have about your book. And I love the correlation between the relationship, the first kiss, the marriage, the children. That's great. I haven't read the book yet, but I love the chapter headings.
I'll send you a copy. I'll inscribe it. It's all yours. Consider that done. Consider that done.
So in order to kind of kick things off today, I was listening to a conference yesterday where a physician was talking about the commonly talked about dichotomy right now between do we stay shut down for the safety of our communities or do we open back up and restore our economy? I loved what he said about it isn't an either or dilemma. It's not something we have to choose between the two. It's really about finding a good spot in the middle, which I think I'd love to see this discussion be today. How do we bring business up in a safe way to where we can find that happy medium? I'm sure that there are many aspects of reopening a business and the economy, and I'd like to ask our participants today to give some thought to some of their ideas of different areas that we need to be addressing as it relates to reopening. In general, there are many areas that we need to think about as we reopen business, whether it's the safety of our staff, whether it's the emotions of our staff, whether it's the safety and the confidence in our customers. So what I'd love to do is ask our participants to, through the questions box on your control panel, share some of your thoughts and ideas of different areas that we need to address as business as we begin to reopen. And then we'll kind of let your comments as they come in guide our conversation. So please take that time. And again, we'd love to hear from you. And if you're willing to let us turn your mic on, we'd love to turn that on and actually get you in the conversation. So share with us your thoughts through the questions box. Let's start maybe, Jessica, let's start with maybe safety of our staff. What are some thoughts you've had about reopening and just the safety of our employees?
Yeah, so as I mentioned, COVID has pretty much become our business at PBGH. And for the last, I don't know, I'm losing count, 6 weeks maybe, we've been entrenched in helping employers try to figure that out. We've had the benefit of having essential workers and many of our employers like Giant Eagle, which is a grocery chain here in Pittsburgh, and MSA, Mine Safety Appliances, US Steel, some employers, the banks, remain open. And so and as you experience as a consumer, 5 weeks ago, you didn't have glass shields kind of between you and the cashier, and you do now. You didn't have signs going down the aisles to try to keep people from being too close together, and you do now. So you can even tell from the essential businesses that we are accessing right now that we're evolving and we're learning as time goes. So for us, we've been, involved from working with companies who supply PPE, N95 masks and masks that didn't know even had names or existed. We've been touching on behalf of the employers and looking at what that procurement supply chain process looks like and how easy will it be for employers to provide access to those materials and essential supplies now as they get back to work. Wipes, employers may have not purchased wipes, or at least in Mascal outside of, their custodial staff really having them. Now they're looking at it, where should they be placed in the workspace? What does that look like for the workspace now? Hand sanitizers, do we have them placed frequently enough or in close proximity enough in the way the work environment will be? Thermometers, we have employers who are working, again, essential workers right now who take temperatures of their employees every day when they come in. Who's taking those temperatures is the question, is that sustainable for the long term? And what is it really doing for you? is the question. You know, we have these practices in place just because we're all learning together, but I do think we're kind of learning rather quickly that, for example, thermometer taking temperatures alone, especially with this condition, this virus, many people are symptomatic. So does that really help? But it provides a level of security for people. Like if you went to work or as you're communicating with your employees and you're saying, okay, this is what our protocol will be as you come back to work. We'll be supplying PPE, masks for you. We'll be taking your temperatures as you come in. And we may even have a nurse or medical director on staff that will provide COVID-19 testing in these situations. For an employee, they may not want to necessarily have their temperature taken, but they're definitely glad their coworkers having their temperature taken and they feel more safe. So these are all the things that employers are now in the practice of creating a safe environment, is considering not only the actual safety, but the perceived safety. And how are we helping employees feel comfortable as they're considering coming back to work? And then a constant communication strategy, probably different than it looked pre-COVID-19. So those are a few of the things that we're talking about. And I know some employers have bits and pieces of it. The testing component is still being evaluated on how to best do that, but we do know employers across the country have already begun testing and are looking at the antibody testing and the role that that's going to play. And now that we have this new treatment, potentially, you can probably say the name better than me.
I can't say it either.
Okay, well, the R drug that is now being seen as promising through some trials, that can change the game in the future. The reality is we don't have that yet. And so it's hard to say what role that will play in the future and how long employers will need to consider how they take temperatures or where testing comes in and where masks come in. So for now, expect to wear masks at least. I expect to maybe have come in waves as far as your work in clusters, maybe not all teams coming in and starting at once. We're looking at data right now to help inform us in our marketplace. And when we look at our data, Pittsburgh is doing really well. We're actually, by the governor's guidelines in Western PA, performing 30% better than what his guidelines suggest is appropriate to get back to work. And so we're very happy about that with the number of average daily cases and average weekly cases. We're doing phenomenal. But when you talk to Eastern Pennsylvania, their results aren't exactly the same. They're not as comfortable or as well positioned with containing the virus and the daily average of infections to maybe go at as fast of a pace. So if you're an employer across the state, you're going to have to look at, well, I can likely open up my Pittsburgh office in this manner. And if I do open up my Eastern office, it's going to have to look a little different. And so, yeah, we're all still learning, but those are some of the key components of making people feel comfortable and safe as we get back to work.
Nice. Marlin, what are some thoughts you've had?
Well, it's an interesting time, Darrell. I have lots of thoughts, actually. My gathering of this time are on two sides. One, practical side. How do we navigate through what is likely to be the new norm? And then there's a spiritual component to it as well that people may or may not understand or recognize or realize that is an opportunity in this time. And so as it relates to people in general, we can speak to this thing in three components: career or work. What was the other two? Community and individual. And so, but as it relates to career, this is an opportunity, Darrell. Now, whether you believe it's too soon to go back to work, or if you're of the group that is ready to go back to work, and is up to you. But let's discuss some things as it relates to that. For those of you who deciding or ready to go back to work and ready for America to reopen and for business to reopen and for the economy to to start again, to begin again. There is opportunity for you as an employee, because to Jessica's point, organizations will move back into the workplace in staggered starts as teams. No one's going back all at once, at least for the major corporations. I spoke with a prominent chief executive in this town, one of the largest employers in this region. And he said, Marlin, we have to go back in teams. We have to go back in staggered starts, because if one person on that team gets sick, then we can quarantine that entire team without shutting down our business. And so this is the new future of work. That said, there's not going to be very many people on campus while your team is there at the work site, which means you have an opportunity to finally be seen. You have an opportunity to finally show your value. You have an opportunity to finally reach out and to shine the light upon your abilities, your capabilities, and your service, and quite frankly, your commitment to your work. So this is an opportunity for you to really do some things, go the extra mile, as Napoleon Hill calls it, and showcase your value. Because now you're not fighting, through layers and layers and layers of people on your floor, in your department or your division. Now it's you and your supervisor and maybe a few others. So now you can really truly show value, which is a great segue into those who do not believe or trust that it is season to go back to work. That's fine. You have very reasonable and practical reasons as to why you believe the such. However, keep in mind, there are 20 million people out of work, which means that if you go back to work with a disgruntled attitude, carrying that particular, I don't believe that this is time enough to go back to work, and complaining when it is time to go back to work, the employer recognizes that there are also 20 million other people that would love to have your position. And so I would leave your political banter at home, and I would take advantage of the opportunity for advancement that will now be available. Because quite frankly, this is creating a Hunger Games. And so it will be the survival of the fittest. So your responsibility, whether you want to go back to work or not, is to, once this reopens, because it's going to reopen soon, whether we like it or not, it's going to reopen, and that's just the reality. When you go back to work, your responsibility is to go back to work, recognizing that this is an opportunity, and leaving the notion of despair and of any other negative thinking. Now, your employer will have measures in place to protect you as well as your employees. So take advantage of that, adhere to that. And I would advise you to, when things reopen, to go back to work with the understanding and even with the motivation to add value while the spotlight can be on you in this time.
I'm glad you said that. Actually, that brings up two people have shared questions that relate directly to what you just said, Marlin. So let's address those. The two questions were almost exactly the same. What do you do as an employer if your employees are afraid to come back to work and don't want to come back to work? And what you just addressed was, well, to the employee, take this as an opportunity. What about the employer? Jessica, what thoughts do you have about the employers you're working with? And what do they do with maybe employees' anxiousness about coming back to work?
Yeah, employers early on started being very concerned about the mental well-being of their employees. And this is a part of that, not feeling safe to come back to work. You also have the financial component. If you read the Wall Street Journal this week, that many employees are making more on furlough through the government programs that are in place right now with additional $600 a week, or the different programs through the CARES Act, are making more being furloughed and off of work than they were going to work. This is a challenge for
I
our
had
employees.
not heard that. That's an interesting statistic.
It is. So when you think about the majority of the workforce, and part-time employees, or, one example in the Wall Street Journal was a car wash that has 500 employees. That's, go figure, a car wash with 500 employees. So they must have many sites. So think about that kind of workforce, hourly workforce, and now they're furloughed, so they're getting medical care. And so they're getting their benefits taken care of, but now they're also able to take advantage of the unemployment and the additional, and they're making more money. So it's one, the mental anguish of feeling safe, but also the financial incentive to get back to work. Is that financial incentive there? Although, albeit short-sighted, because the money shifts and come July.
It's not going to last forever.
It's not going to last for long. So I would encourage employees and employers to educate employees about that. About what that really looks like, and that does, change in July, and that, I don't think it should be out of position of threat. Employer, more than anything, this time has taught us, to what your song said, coming into this call, is that we have to be together, and we can't have the employer versus employee culture any longer. We are literally going to have to build together. So employers' responsibility is to be sensitive to that, in the way of leveraging the paid time off provisions that, there's a Family Cares Act now. So there's some things that you have to comply to by law if you're a certain size employer, but look beyond just compliance. Look at what is the right thing, and how should you approach PTO now? How should you approach FMLA and leave of absence policies? Be inclusive in your approach to that, and really think about not what it used to be pre-COVID, but what it needs to be in the future to create a culture of safety, a culture of well-being, and a culture of productivity as well. And so I would say, from a mentality perspective, both sides have to look at that, and incorporate EAP, get better engagement of EAP, which we have more than ever. We've only had like 2% engagement in EAP for decades, and now we have significant access to that. People are actually using it. Telehealth, mental health, and many employers are looking at that. So I would say, if you're planning to open in 3 weeks or 4 weeks, if you don't have a telemental health plan with either your health plan or a direct vendor, I would ensure that that's a key part of your strategy, and have that be a part of bringing people back into work. Connect them with a counselor, have them talk about their safety concerns and their insecurities, and really leverage that feedback to create a policy and a culture that's going to make people feel safe. So I think we need to be flexible. If we have a hard stop, you're in or you're out mentality, it's not going to work for us in the long term for anyone. And both sides have to be able to and willing to work together.
Very good points. Marlin, what are your thoughts about this emotional aspect of the anxieties that are associated with employees coming back to work?
My concern is just that, with the anxieties that people have about returning to work, your employer has lost a significant amount of business, and now has to be more efficient than they were prior to quarantine, which means that they've got to get people back to work. But when they do, in order for people to have peace of mind to produce or to thrive, there has to be protections in place that people feel comfortable with. So I would say, to Jessica's point, that your employer has, or at least should have, your best interest in mind as it relates to bringing you back to work with a sense of peace, to be able to produce at a level of efficiency, to catch up and then to move forward, because it's going to take some efficiency to catch up. We're going to be economically seeing the residual of this thing for the next 2 years, nearly. They're calling it 18 months. And so your employer is going to have to be more streamlined and more efficient. And in order to produce at that rate of efficiency, people are going to have a peace of mind coming to work. They're going to have to be all right with coming to work. And to address being all right with coming to work, there will be measures. I'm trusting that there will be measures in place that will create that sense of partnership with the employee. To my wife's point, whether they're taking temperatures at the door with the laser gun to your forehead, whether you know,
Let's list the device.
I don't know the technical name for the medical device, but it is the device that they hold to your forehead, they scan it, and their temperature shows up. You know, and so which is a touchless, technology. To which now they're using. In fact, I just ordered one on Amazon for my family. But and for guests coming in our house, before you come to our door, let me scan your forehead. And so there will be measures in place. Now, some employers will take advantage of hiring nursing staff to be on site, to take temperatures and to provide, to administer testing, because for one thing, it's one thing for you to be tested, but it's another thing for you to know that your coworker has been tested. That's the anxiety, is that your coworker has been tested and that your coworker is cleared to work with you. And for you being tested gives peace of mind to your coworker that you've been tested. So on the sheer strength of employers needing to thrive more than ever during this time, within the next 18 months, they will be providing, it's my professional assumption that they will be providing measures, safety measures that will provide peace of mind that you can thrive at work. And that includes, for some employers, continuing to, have their employees work from home. For others that have to report, there will be some things on site, I would imagine, that will provide peace of mind. I don't believe that employers will be cavalier with your health.
Yeah, if anything, it's going to probably be throwing the kitchen sink and then like paring back as we learn what's more effective. And we've done that. I mean, we threw the kitchen sink at, hey, employers, we have a vendor who can help you with COVID testing, thermometers, these several different masks, an engagement tool, telehealth, and now we're even in several weeks in saying, okay, we know that some things are more perception versus reality. Now we're going to have to address perception, which means like the testing. We know the testing, there's, some of them have not the greatest efficacy, maybe 70% accuracy, some less. How do we determine which ones are more accurate? How do you pair that with symptoms to or if we have a testing policy, which I don't think is the most effective. I don't think you should expect your employer to test every single employee before they get into the office. We just know too much information now around the accuracy of that alone. So yes, maybe testing is a part of the protocol with symptoms or with, a questionnaire or an assessment being done that says, yes, these folks need tested or not. And I think it's important to be kind. We to your coworker who may have had COVID during this time,
right?
Your family did, and how the stigma associated with that now. Even with just your own personal walking to the grocery store, people don't give eye contact, like you're going to get COVID from looking at each other, or smiling through your mask. It's, so that's going to go to the workplace, and we have to be employers and managers, frontline supervisors, team members who are just natural leaders on their team, go into work with that mindset of being aware that there's a stigma now associated with having a virus, and how we need to make sure everyone feels comfortable that we are back to work. So the communication is going to be key. Employers being clear on what that protocol is essential, so they know what to expect, and a constant reminder, almost like your team huddle every day, of how do we continue to be together in this, with our team members. So,
and gathering their input, and listening to them as to what their concerns are, and making sure that they're heard as we come back to work. Marlin, one of the questions that came through was, what do you think the impact that this is going to have on renewal rates in the health insurance world?
Oh, that's renewals. There's an interesting, and Jessica can also speak to this, but I'll say this prior to passing it to her. There will be an interesting pivot with health insurance and benefits moving forward, Darrell, due to the new environment that we're in with COVID and with leave of absence, with FMLA, with working from home. Okay, so, and I'm going to address the question, but let me say this first. We're moving into an environment that now, when you tell your employer that you're not feeling well, that employers will not manage in an old school fashion that says, get in here anyway. You slacker, you. Who stays home? And so we're moving into that kind of environment now that when people say, I don't feel so well today, then the employer's like, hey, stay home, and so. Are we
Sorry
good?
about that.
That's
we're
okay.
good.
That's okay. Stay home. And so as it relates to renewal rates, it'll be, I don't have the answer to that, honestly, but it'll be interesting to see how these things pivot with rates. Now, rate increases are just, the name of the game. It's just what happens. and I suspect that will continue, because, these are for-profit companies, doing business, to sustain themselves, and thrive. So I wouldn't suspect that there would be much difference in rates or any types of rate increases, but that same type of trend will continue now more than ever, because there will be a different type of healthcare administered, different type of benefit program or platform introduced to the employer, the employer's suite of offerings now. So now we have to approach health and welfare benefits entirely different now, Darrell, because of this new environment that we're in. And now we're moving into a space where there have to be products created to match the day that we're in, the new hour that we're in, the new norm that we're in. So I would expect that rate increases will be the same and they'll continue to increase.
So, we've been hearing, sorry, did you want to?
I was going to say, maybe let me share another question, and Jessica, address this along with what you were going to say. And by the way, Malcolm, I'm going to turn your microphone on, and we'll hear from you in just a second. So Malcolm, I've turned yours on. You may want to just mute it on your end until we're ready to have you included. But here's the question, Jessica. Malcolm, I'm going to turn yours back on because there's a noise in the background. So here's the question that came in. Since 70% of elective procedures were delayed in hospitals, do you think there might be, for employers, a false sense of safety with possible lower rates this next year? So that's an interesting question.
Yeah, it's a very interesting question, and I actually was going to touch on that. So I'm glad you asked it. So, okay, we've been hearing rumors from flat to 40% rate increases for 2021 plan year. That's a massive range. What goes into that these different numbers, I think, have been this idea that, well, for example, I had a question come in to me from a reporter this week that a consumer called them because her car insurance called her and said, hey, because you're not driving, we're going to give you this rebate. You're not really using your car, so we're actually going to send you a check. And so she called and said, why isn't health insurance doing this? I'm not using my health care that way. Our employers getting checks, right, and our employees or patients getting checks from our premiums that we're still paying through our paycheck, since we're not using the care that they thought we were going to use. And so I got that call, and I love the awakening of consumers. Those are questions employers should be asking right now. Right. Clearly these procedures that were planned that went into my premium or to my administrative fee this year aren't happening. So how is that going to play a role into how we move forward? And did we identify waste in a care that shouldn't have happened anyway, that didn't happen?
Right.
How do we
Right.
keep that out of the plan in 2021? So some of it needs to be, of course, a rate increase discussion. I do think fully insured versus self-insured, obviously you kind of have more opportunity to affect that than not. If you're self-insured, you can make some clear strategy decisions and vendor decisions and programming decisions that maybe fully insured doesn't have the same level of flexibility, but that same type of conversation should be happening whether you're fully insured or self-insured. What waste did we extract that we know shouldn't have happened? We created behaviors now that we've been trying to have with people not going to ER for things they shouldn't go to the ER for, right? So site of care approaches should affect a better outcome for your renewals. Now that we've actually modified behavior we've been trying to modify without something so drastic happening, right, Darrell?
Right.
Telemedicine access, how do we, accessing that? For our data increased 240% from this year as a result of COVID-19, 240% increase in telemedicine. Although albeit, I still think it's a little bit low, even with a 240% increase. But we're on the track to that being a primary way of accessing care. That's less costly. They still get reimbursed for it, but it's less costly. How is that playing into renewal? So if you do get a 30%, 40% increase, I would not just take it and say, this is all that could be done. Those are the conversations that need to happen, that need to be quantified and proven from your health plans as to justify that number. We do expect, of course, that some of these procedures that were delayed will happen, and they probably won't happen this year, right? So what goes into that increase for next year will be this anticipation of what was supposed to happen this year. The question is, okay, that's fine to consider it for 2021, but we know it didn't happen this year in 2020. How is that going to look in a form of a rebate or a form of some kind of provision from the insurance companies who are frankly reporting pretty good markets to their stockholders right now, pretty good rates, increases in profitability. So good question. I think still to be determined. I think some people are going to be, especially the smaller companies who don't make decisions until later in the year. I'm expecting a lot of them will stay kind of status quo. There's been so much disruption that they may not change plans in a way that they plan to this year. This might have been the year they said, we're going to change my health plan vendor, right? Or we're going to add these programs. And now they won't have enough, a lot of time and all this disruption and creating new strategies for PPE protocols and things like that probably will keep some people kind of where they are or where they came into this year versus making some changes. I do think that might happen. And I think employers are going to leverage data more than ever to look at their PBMs and look at how they're contracting to ensure that things aren't just inflated in the form of rate increases moving forward. I think this kind of awakened all of us as consumers, the employer as a consumer and employee as a consumer, to ask some questions around what waste and efficiencies can we maintain during this time. Yeah. Nice.
So here's a question that came in. It's a little lengthy, but let me read through it. It says, we cannot have these conversations without weighing the impact of opening the economy and the capacity of the health systems to manage the potential for an increase in cases. We have to also take into consideration the health status of the workforce within an organization. Businesses thrive with a healthy workforce. It's critical to take a more holistic view of how we balance out the economy and welfare of employees. This is a very real threat that is not going away anytime soon. Since 70% of the elective procedures were delayed in hospitals, do you think employers will get a false sense of safety with lower rates? So I guess I'm actually reading two questions there. Sorry about that. But what about, the whole idea of if we open too quickly, are we at risk to, again, overwhelming the healthcare system? What does that look like? Any thoughts on that, Marlin or Jessica?
Go ahead.
Okay, so yes, I have thoughts on it. And again, we're looking at the data, and we know that, and we've, in Western PA, we had a total of 79 deaths in the Allegheny County. we have to balance the total well-being in both physical health and mental health. And the financial implications of not working is a major strain on mental health. That is a health, that it's not like a bucket of working and then not working and health, somewhere else on the sidelines. That's all integrated. So the security of being able to get back to work is just as important as the security of ensuring that we're not, and creating an environment where people are at risk of getting a virus. Okay, so and it's, I don't know if we have a perfect science with it. The reality is, it's if you don't go back to work, there's an issue with you. If you do go back to work, there's an issue with you, and it can't be this line. It's not. It's how do we look at data to make these determinations? And if we start seeing an uptick from a public health perspective, how do businesses now create a protocol to ensure that we react and respond very quickly, and have a plan for that? We weren't planned for this. Our pandemic plans that we had as businesses were on a shelf unjust since the avian flu days, and literally had not been updated for the most part, right?
Right.
So we just have to figure that out. But I would say that employers have to create a culture of safety. Population health and business are now, confirmed to be interdependent. So it's not business or population health. Businesses are in the business of population health. Health matters, but financial security is a part of that too. And getting back to work is essential to creating a financial security. So again, I think a lot of things I mentioned, leveraging data. Our data shows that we're in a good place. And if we trust the guidelines that our government or governors are sharing across different states, then look at that data and how you're faring compared to those guidelines, and create a pathway forward. And a pathway forward is getting back to work. I do think, to Marlin's point, telework and working from home, and managers and businesses who thought that was never possible, well, they were fooled, right? They fooled you. It's possible, you can work from home. So I do think where people can continue to work from home right now until we figure out how the uptick may impact us, do that, but we have to move forward.
Well, and that's actually one of the questions and comments that just came in. How would employers adapt to adopting teleworking more often than ever? And I think that's truly the case. This has proven to many employers that there's a lot of things they can do from a teleworking environment.
Yes, it has.
One of the questions that just came in, this is an interesting question. Do you feel this is where we see the end of the healthcare system as we know it, with fee-for-services, and looking more for solutions like direct primary care and direct contracting? What are your thoughts about those areas?
So the answer is absolutely yes. Whoever asked the question is brilliant. Probably she should ask the name of the person, but we'll leave them anonymous. But that is a brilliant question, and the answer is yes, my friend. To you, things will be different moving forward from here. I'll let Jessica really tap into the weeds of that, but absolutely yes, and then I'll respond after that.
Yeah, I agree. I think we've been pushing for direct relationships with providers and employers for a while, and we know that's happening. It had been happening with primarily really large companies, or very independent companies in different parts of the country, but not so much in Western Pennsylvania. Here we hadn't experienced that, but we've been educating for years about what that would look like and why it's so essential for providers to be closer to the employer as a purchaser and the employee. So we have a little toddler creeping into our meeting. We apologize. So the answer is yes. Employers there's no more status quo. When we say get back to normal, there's no normal. There's a new reality.
That's right.
Okay, reimagine everything. Take this as an opportunity to do things different. I mean, some people, I know this is controversial, but the role of this universal healthcare, mentality, when you think about 22 million people out of work, and if they're not furloughed, they're not getting benefits, and the employer dynamic with offering benefits through the employer, you know, is that the right model to have, right? How do we telemedicine? People didn't know that, and we're still educating employees that if you're laid off, employers are, in many cases, are still paying for their telemedicine, or they can still access mental health and telemedicine directly. So, you know, every person has been awakened, and for us to think that we're going to manage our plans and contract with the same folks in the same manners as before, without considering direct contracting and direct primary care and a true patient-centered model and consumerism strategy, we will be behind maybe forever. So this is our opportunity, and those who take it will reap the benefits. So reap the benefits of health, and they'll reap the benefits of financial security in a sustainable way. So I'm not, and don't take me as advocating for universal health care. That does not represent the consensus of all of my members, disclaimer, but I will say that this has had us question the way our model is today. And it's highlighted and shined a light on the major disparities that exist in the way that we procure and engage with how we access the system, and it has to fundamentally change.
Here's an interesting question. We're doing worksite testing for essential businesses. Do you see a greater need for this nationally? Or is this a single point solution to a much larger protocol? So the idea of doing the worksite testing, and you brought this up, Jessica. I've often thought, you know, is the way to get back to work to come up with some kind of a simple, easy solution to where everybody coming into work just gets tested. And if you're healthy, you go into work. And if you don't, you go home, and maybe you send a few people home that are healthy so that nobody knows which ones are healthy and which ones aren't. But what about this idea of building testing in for the work site and kind of that safety and confidence of everybody that's there, that everybody around you's been tested and safe?
So there will be innovation, Darrell, innovations that we've not even heard of yet that will be implemented.
Yeah.
There is no one size fits all, and there are no hard lines. There will be multiple. Now there will be vendors coming out of the woodwork with technology solutions, medical solutions, and everything else, especially with the tech environment, the tech sector growing in this country as it is. There will be an array of procedures, of platforms, and of quite frankly, new ways of recognizing one's health. I mean, Apple is partnering with Google, you know, on testing folks and or actually not just testing them, but being able, say it again. Yeah, tracing them for those who've been tested in, and who this person had contact with, and then how many persons they've had contact with, to be able to isolate. So there will be a number of new things happening as it relates to that. So to that question, no, there won't be a one size fits all. There won't be this one particular thing where employers will just be testing you, again, with the ray gun at the the laser gun at the door, but there will be other things to do, especially at home. And so I foresee things happening in the home prior to leaving out the door to come to work.
So we only have a few more minutes, but I would like to ask, this is an important question that I'd love to hear your comments on. Do you think going back to work will have a negative impact or effect on the Black community due to COVID's affecting the Black community at a higher number?
So that's a great question.
Yes.
And I will first say that it depends on where you live. So if you live in an environment, now Pittsburgh is an environment unique to any other. Pittsburgh is a highly segregated region. There are invisible lines in Pittsburgh. And the Black community is isolated, and we haven't, and due to that fact, we haven't been seeing in this region what the Black communities in other regions where there's a larger Black population, such as Detroit and such as Louisiana, New Orleans, Louisiana, and Chicago, Illinois. So it really depends on where you live that you'll be seeing these increases of the virus, transmitting from one person to the next in certain communities. It is not linked to going back to work too soon. in my opinion, in my professional and humble opinion, because here's the reality. If these folks don't go back to work, there'll be disparities that'll happen worse than COVID-19. And that's what has to be evenly weighed.
Yeah.
You know, and so there will be measures in place to combat a sickness. That's the medical system we have, the healthcare system that we have. They will combat sickness, you know, and that includes coronavirus, you know, and anything else that comes after it. But as it relates to going back to work too soon, I will say this: it will always be too soon. If it's a year from now, we'll be asking the same question: are we ready yet? You know, and that's more fear than it is logic. You know, so go ahead.
Yeah, let me interject a little bit on the African American component. I think that is a very real question, and I think there is a major risk with what we've seen in the headlines across the country on the disparate impact that this virus has had on the Black community. There is evidence and research, like a Pew study, that debunks some of the myths that Black people thought they were immune, or they didn't care enough. There's a Pew study that actually says they were concerned earlier than their counterparts about this virus, and they were concerned about themselves earlier than they actually had a fear that they would be African Americans would somehow be disparately impacted from this. So, you know, there's myths out there around the mentality of a culture of people that aren't true. And there's now evidence in Pew studies and research that's been done around, did, you know, Black people take the precautions like other people? Yes, they actually did. Were they concerned? Yes, they did. And they did everything they could. But we had disparities that have been highlighted through this that existed way before COVID-19.
And that's my point.
And from racism to health conditions like diabetes and food insecurity,
and poverty
and hypertension, right? So I think the opportunity is that we know there's to stratify the risk, and you know that there's a variation of risk. You have to put disparate effort to those different risks, and a disparate effort needs to go to the Black population of your workforce, and how we're addressing some of these issues that have been highlighted. And as an employer, you have claims data. I mean, it's no secret. It's been on every headline: diabetes, hypertension, all these different conditions. You may not be able to do much about systemic racism, but you can create a culture of inclusion in your company from a culture perspective, and a culture of safety. And you can look at your data and say, I need to put disparate communication or disparate efforts through this hypertension program, or to address diabetes differently than I did before. And I need to ensure that this population maybe gets communicated to a little bit differently and a little bit more frequently. We can't do cookie cutter approaches anymore where the disparities and variation has been highlighted in such an exaggerant way. So that's my take on that. I do think that's a great question, very fair, and I'm glad people are thinking along those lines.
Yeah, so kudos to whomever asked that question. It's very real. It is very, it is very real, and we've got to never let it move forward. Yeah. Mm-hmm.
So with our last few minutes, what I'd like to do is give both of you a couple minutes to maybe share any thoughts you didn't get a chance to share as we wrap up the huddle today. Marlin, do you want to go first? And then Jessica, just any couple minutes of things that you'd like to make sure we put out there.
So yeah, at the beginning, I spoke that there are two components: one practical side and one spiritual side. I don't, with respect to your platform, I would like to address the spiritual component, which is the thing that I can speak to with the most experience. And so I would admonish every viewer and every listener to this, to hold fast to your faith, knowing that God is still on the throne, and recognizing that this too shall pass. And so when you recognize these things, then your anxiety and angst about going to work too soon, or if I should wear a mask or not, these things now become trivial when you recognize that there is a responsibility that you have to faith, and a responsibility that you have to family. This is a season that has been provided, and I will say that has been provided for us to recognize the things that don't cost anything that matter so much.
Mm-hmm.
We've been spending more time with our children that have been asking, even almost crying out for our attention because we travel so much. If I'm in town, she's not. If she's in town, I'm not. You know, and when we're both in town, we have meetings back to back all day long, and we're still yet out of the house. Now this has brought back a sense of family, and this has brought back a sense of appreciation for those things that matter. Yeah, sure, they have distance learning, and it's nerve-wracking when you're trying to conduct meetings, and she's trying to conduct meetings. I'm on a webcast, and she's on a conference call, and the children are in their distance learning. Nevertheless, our house has become a home again. And and that's probably the most valuable thing. I told my wife we're going to come out of quarantine better than we went in. And that's in every aspect of our lives. So I would encourage every single one of you to come out of quarantine better than you went in.
Jessica, we're out of time, but take 60 seconds and give us some final thoughts.
Well, I appreciate that. He really said it, Darrell. I appreciate the opportunity to have us both on here on our 10th anniversary of meeting one another.
9 years married.
9 years married, and just to emphasize, and one example, Harvard and Yale are giving out free courses, right? And for free, and you have a nominal fee to pay for a certificate. Let's better ourselves, and it's going to better our communities. Focus on our communities. When you hear of the need in the communities around you, we just heard of one of our cities right outside of Pittsburgh, just a few miles, in need of feminine products and food and basic needs, and we're only less than 2 full months into this. That's only going to get louder and greater, and we have a responsibility to take care of our communities.
That's right.
Figure out what role you're going to play in that and commit to it for the long haul, because this isn't once we go back to work, assuming life is okay for everyone. It's not okay. 22 million people have already lost jobs. Many people were living less than paycheck to paycheck, and we're already on the brink of homelessness for missing a paycheck. And now we're seeing that reality happen. So please commit to your communities around you and to the people around you.
Thank you very much. This has been wonderful. Thank you so much for your participation. I'm just going to sign off and say that on Monday, we have our next huddle. Natalie Steiner will be talking about how to schedule your meals at home as you're working from home. So join us on Monday. We'll sign off, say goodbye to everybody, and thanks again.
Thank you.
Thanks, Darrell.